Hi friends, today we are going to discuss independent admission of minor under Mental Health Care Act of 2017. I am Dr. Suresh Padadman, Professor of Psychiatry, Head of Telemedicine Center and Head of Forensic Psychiatry Unit at NIMANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic purpose only. And if you want to have a legal opinion, please do contact an advocate. Conflict of interest? None. This presentation is from the Mental Health Care Act of 2017. I am discussing independent admission and admission of a minor. There are two types of admission under Mental Health Care Act. One is independent admission, another one is supported admission. Independent admission is nothing but voluntary admission. Supported admission is nothing but involuntary admission. In this video, we are going to discuss only independent admission. For supported admission, I have made a separate video. Please do follow my channel to look for supported admission. Coming to the independent admission, again there are two types of independent admission. One for adult, which falls under Section 86, one for minor, which falls under Section 87. How we are going to discuss now one after the other. Section 85, the independent admission has been defined. The independent admission refers to the admission of a person with mental illness to a mental health establishment who has capacity to consent for treatment. So if the capacity is there, then he will be considered as independent patient. However, Section 86 talks about the procedure. The procedure is the person under Section 86 should be an adult, need to have a mental illness, and he should have capacity to consent for treatment, and he will request for admission in Form C. This is how the procedure goes. Independent admission under Section 86 fills the form in Form C and requests for admission. Now the medical officer will decide on what are the circumstances he can admit. Please look at Form C. This is the Form C which is available under Mental Health Care Rights of Persons with Mental Illness Rules 2018. These forms will be made available in each mental health establishment and should be given free of cost. After filling this pro forma, he will give it to the person who is in charge of the mental health establishment. Now, the medical officer, after receiving this application, and if he is, after the assessment, if he is satisfied, the person with mental illness who has given the application has severity requiring admission, and he is going to likely benefit by this admission and treatment, and he has capacity to consent for mental illness, and a person admitted as an independent patient shall be abiding by the rules of the establishment. Just because he is independent admission doesn't mean that he will not abide by the rules of the hospital. Consent will be taken by the patient only, not by any other person, and the presence of NR is not required. The patient can stay alone and the patient can be discharged on his own. This is what is the crux of independent admission or voluntary admission under Mental Health Care Act. Moving on to the next one is admission of minor. Minor is any person below the age of 18. So that comes under Section 87. Again here, in independent admission, that is admission of a minor, the parents or the NR or what we call it as a legal guardian will give an application in Form D. Once the Form D has been given, the person who is in charge of the mental health establishment has to do following things. This is again a Form D. The Form D is available under Mental Health Care Rules, Rights of Persons with Mental Illness section, under 2018. Once the NR fills this pro forma and gives to the medical officer in charge, then following thing has to be done. After receiving the application, at least two psychiatrists should examine the child, or else one psychiatrist and one medical officer has to examine the child, or one psychiatrist and one mental health professional should examine the child, and the examination of this minor should be on the day of admission or within the preceding 7 days before the admission. So within that period, if they have examined and issued an independent certificate that this child who has severe mental illness, and the admission is in the best interest of the child, and the child will benefit by this admission, and all community-based treatment has failed, and this is the only way we can help the child. And the child will be admitted in a separate children's ward. The child will not be mixed with the adult ward. However, many of my colleagues do ask, if there is a single room and it's what we call it as a general ward, and there is single rooms. In one room there is an adult patient, in another room it's a single room. The child, yes, it can be kept, but you're not going to keep the child in the adult ward, in a general ward where the adult patients are there. And very essential is, when the child is admitted, here NR is going to stay. That is nominated representative. If nominated representatives cannot stay, an attendant should be appointed to stay with the child. Suppose if the child being a minor, that's basically if it is a female child, female NR will stay, or if there is male NR, a female attendant has to be appointed to stay with the child 24/7. For every treatment, nominated representative consent is must for admission, for treatment, for discharge. And within the admission of 72 hours, the person who is in charge of the mental health establishment should inform the mental health review board. At the same time, mental health review board shall or may review the admission or the records or interview the patient. However, the law has made mandatory review within 7 days if the child is admitted for more than 30 days in the mental health establishment. To conclude, my dear friends, independent patient means a person who has capacity and he will retain all his rights during his inpatient stay. But however, person with mental illness will follow the rules of the establishment, and the admission of minor will fall under section 87, and the nominated representative's consent is a must before you treat. So discharge planning and discharge are discussed in my next video. Please do follow my channel for the videos. And if you like this video, please do subscribe to my channel and press bell icon for notification. Thank you very much. Please stay safe.